Ublatia Nunavut mute, Ublumita qua 11, Nutango Nuban Naraka to Nunabuidoni, and Matadlimat Nuban Naraka only to Mamitu. Aquatama Milukta Nutango Yakalung Nitluti, Katilukta Suge 67, Nuban Naraka Lecto, Nunabuidoni, Yakalung 61, King Aini Hitamat, Kangasana Mimago, Amatako Nuban Naraka only. To time ang Iqaluit ni piga mata 39 mami himayut anya unya to ublumi mutikid lugo ta kwa kapiyo himayut no ban na yo ta ray ko timino no builoni 15,856 hiwula pa mi kapiyo himayut mata kwa no ban na yo ta ray ko timi kingu leni kapiyo himayut 12,395 mata kwa udunga ko ataka to hakta uga haktu Mahan nakawi himay lektu ta kwa nuban na yo haktu ta Inuit ta taikani tiguyo hima bingmi Baffin Correctional Center ama makiga bingmi ta kwa taikani nuban na yo kalekto ta kwa tiguyo hima yu taikani ila ko tito himayut ama ta kwa kawi hakta unia taikani piliri lukta ama tiguyo himay Tiguyo himay lukta to tako nuban na yaking mata kawiyak paleo yumana kawiyak lukta ila kawiyak to lukta niyan mata na to kawi himalak tigu to tabanya kalung ni taikani tam mata wingmi taikani to tam mata wingmi nuban na yakak man taikwa taikani piliriyut taikwa tam mata wingmi utat man na kawi hakta uniat kawi hakta padle yun nuban na yaking mangata mata ko ilang inutu hibing mi titaw laktut taikaning taikang anihi masutin inutu hibing mi laktut ako ilangin ito kay mari Dr. Patterson watchaw tana unika kan nerang matana ko wenak tumi huligalo wakawama ta ko nang minakaktut nunumoiloni ta ko mikitu nang minakaktut kinaw yang mika tukhiraktu lanang miyut ikpaka unika yalo ta ko nang minakaktu mikitu ni $5,000 kinaw yang tukhiraktu lanang miyut ta na ikakay molotit gov.nu.ca/elingayo CSBSP dan auling inironi people deti chikut pilirianu kawiya lotit ikakibikut kakitaw yakutat na kinaw yak uktok tulo mahanan na ulang ilang may manakago kawihat siya na pugut akagupiya lo ila tayo mga kawiha ya kakalo akta matako malit chalogit anya tayo litichiku malik daw ko yangin tako malit siya ngukupti o taan na abungak kanak taan na ukwa kemana pinek to kemana takig dinakman nunat ko tikut aula oyak sintabani akalug ni ilangit ami hutwit kinap pa mi matwa mi atok tangim mata ingloyang mi anigowit matwa mi atolot kinap pa mi atolotin takwa kina pa atul laking mata kina la matuan amata ko okay na hoktaka agawang mitsa talawit kanigilwak tangin luta ublaluk tangin luta ublaluk tiakang imma luta kapiyaw lutit nuban na yata kay kutimi tana atul laking man tana moderna nuban na yata kay kutit tik tamani nubumi atok tabot ayung itchato piggo chato na kapiyo himalagowit piggo niya 94% mutikina mamagolo ti kapiyo himagowit na ato like to nunabumi utiliok chalo pagka kapiyo na puthi nunabumi kayo to chak pagka tiliok to sugit kapiyo na puhi nuban na ratari kutimi ta na moderna mi mahibulak pa mi kapiyo gowit kingul mi kapiyo kanaliti matnaw yuhi nunabumi. Today, we are reporting 11 new cases and 5 recoveries of COVID-19, and they're all in Iqaluit. There are 67 active cases in the territory, 61 in Iqaluit, 4 in Iqaluit, and 2 in Rankin Inlet. There has also been 39 recoveries to date since the start of the outbreak. To date, 15,856 Nunavut Mute have received their first dose of the Moderna vaccine, and 12,395 Nunavut Mute are now fully vaccinated. A few important things today. We have confirmed cases of COVID-19 at the Baffin Correctional Center and Iqaluit. These inmates are isolating, and other inmates in custody are being kept separate. All staff are taking appropriate measures and precautions and have strict processes and protocols in place. All inmates and staff are being tested to determine if there is any additional spread. We also have identified cases at the boarding home here in Iqaluit. All guests and staff at the Tangmatawig are being tested to determine possible spread. Some individuals have been placed in isolation at a different location. Dr. Patterson will have more details on the situation in his update. To end on a more positive note, as I briefly mentioned on Wednesday, the government of Nunavut is doing its third round of the COVID-specific small business support program. Small Nunavut business can now access another round of contribution of up to $5,000. For more information and the application, please go to gov.nu.ca/SBSP. This is now open, and I encourage Nunavut small business owners to apply. We are here to help and support you. If you don't remember the website, you can go to your economic development officer in your community and ask, and you will be assisted. This weekend and until this outbreak is over, continue to follow all the public health measures. I'm shocked by how many people around Iqaluit aren't wearing masks. Come on, guys, wear masks, it works. You know what to do. Mask up every time you're outside your household. Wash your hands often. Keep strong physical distancing from others when you're outside. Stay home. Get vaccinated. We know Moderna is effective against this variant of COVID. So make your appointment and protect yourself. And I thank all the Nunavut that are adhering to the public health measures and doing their part to stop this outbreak. Thank you.
Black uli. Morning. Koyan namik. Igelang indim ni ubla. Uli koyan namik umabluti inuktitularit ni atu taktum marialo katangman. Tukisinatsia katak tututiddu koyan namik pilaritsia vitamatuminga. First of all, I just want to thank Uli for the tremendous work that she has been putting in interpreting these COVID updates. It's great information and greatly appreciated by those who do not have English as a first language or a language. Ublatya, ako nilo ako mangikalok ng ublumi kasi ni ukaw sa kaya po na itamak ko tagwan ni Premier Louis Waksa ilubang alo asing ito tagwan ni ukakatak to pingwang itya kapta pidlat tamaring may ukaw sa kakapta aman naro nang ito ni tamani ikalung ni taman na nuwag juang na siya magpadliya ni nga ni ang ngutibaldiya tilduta tamap telukta tamat tuminga pilaraya kang nayakapta nukkaktit tumaguptiut aman nukkaktit tumayabu naro nang ito ni ay si mayaraya kaubit ay si magit ugla kang ildutit ama uglak ti kakatang ildutit iglubi sila tano pilareak sa karne arubit matuak si malutit amma ani yarea kam marikubi kisiani ani yun naklutit makua katigiayan naptela kubiya naktaktakaya kanga naldiuti naktakakanga sunaldo naldiuti yakanga ta katigiayak kapta tayo man nailiw ko yung ityakarwak puguman na ikalung ni niuvirearea karubit inutuluti niuvirear lutit matuak si malutit lo Good morning. I don't want to take too much of your time today, but I just want to remind people that what we're doing here is very serious, and the advisories that we are giving are real. As we catch up to the spread of COVID in Iqaluit, I need everybody to do their part to ensure they aren't adding to this outbreak. Stay home, don't go visiting, don't have visitors over, and don't socialize outside your household. You should not, under any circumstances, go to or host a party. Do not travel unless it is absolutely necessary. If you need to go to get groceries, go alone. Any other errands, go alone. Do not leave your house without a mask and wear it in all public spaces. We have to do this if we want the spread to stop. Taman siya magpaliang Manila narunay ko takaktong nuwagjuang na B117 mi. Tam na siya maala naksawmat si wuldang may nuwagjuang na tikilaw si mayumi. Taman na itidlugo tamag ko udjak tokto yageli udjak tokot siya kalwakap tigut. Amma kapiyaw yun na pisungak tok kapiyaw yak tokit. Takwa lumaligya kaktagut o kausakisak tak kamalig lugit. Kaya man nakisiya ni taman na siya magpaliyat siya ang iman. Miya nakajuti kaya kakapta, ane ako yun ng iman, ane ako man ng iman lo. Ayong nalawang ito galo, tamag ko o kausakin naktabot, maliktaw ko yabot. Maling ikuptigut, aw yaro tituin na kaya kaktugut, tamatuminga, unatakasugluta suli. Ikaw matataw, tamag ko ano takkan, nuwag ikutinig. Nuwagjuang ay kutini kaputini ayong mataman na kisiya ni nuwagjuang ng migtaw anela unna tiyang mata udjak to tilaw tamakwa nutakabut ang ngotay iluli tamakwa nutakkat sanan naungin nga ni udjak to tiyang niyakpugot. The B117 COVID variant is very transmissible, a lot more than the original strain. Please do not take chances with the health of those around you. Get your vaccine. Follow the current measures and don't take chances. It's just that easy. We're all in this together and we can only get this and beat this if we work together. This is about public health. Again, stay home and get vaccinated. It's pretty much that simple. If everybody doesn't do their part, we could be in the same situation for months and maybe even lose our summer. Please keep in mind that we cannot vaccinate our children and we need to protect them. Think about that and act responsibly. Have a safe and responsible weekend.
Good morning. Earlier this week, we announced that the B117 variant has been detected and so far appears to be the only strain of COVID-19 in Nunavut. As this variant spreads more easily to limit transmission, we are announcing the following changes to the rules for those granted exemptions. Everyone living in the household of someone who is isolating, including exempted critical workers, anyone who has traveled out of Iqaluit to their home community, or those under an isolation order for exposure to COVID-19 will be required to isolate. If you are an essential worker, you will be required to follow the same rules as an exempted worker. This means that you are only permitted to go to work and then home, wear a mask at all times outside where you are staying. If you cannot find someone to deliver groceries, you can shop once per week during the 14-day period of isolation. If you are not an essential worker, you are expected to stay isolated at home. These orders will come into effect Monday, May 3rd.
Ula sakut tabani pinasa ako spiga kata tilugo nalo na sila katata na B117 ngoni kakta Nunavut 19 na si Jipalayok. Kaya si mayo kamalutan na to ya sunita mani Nunavummi. Tana si Jipalayok Nunavut na sumalom na lakin ni ano sa masakay na sa uninganik sa matay kanitit sinemo nalo na sibugo kuninga si Jiktaw ni ato ni maliktaw gyalen nikta kuno nga anigiatut teilit titau hattarsimayunun. Kinatuinna illumi uqaterharuni anitteiliquyarussimayumik ilagiyaullutik teikkua anitteilissimanningittut iqqanaayerearsimayunik tamaunga Iqalunnaullarsimayumini upatanunanginni ammalutaakkununga anitteilititauyunnu katiyahatuinartuminiuyunni Nunavut 19 linnik anitteiligiaharnialertuin. Pimmariuyumi iqqanaayaaharavitaimaat sainnermalittaugialinni maligiaharnialertuti taakkununga iqqanaajartinu tikititaussimayun anitteilititaulauqatik. Tamanna tukillik taimaa iqqanaayarearlu tikisiani angeqqamulluutit sautigihattarlutit. Matuarsimainnahattarlu sitaimangalima aniniatuaraigutsi. Ammalu niuveriartitsaminekini nanisigunnangikuvit niuveriarhattarunartusi ataussaallusi pinasuarussiu iluani ulluni 14 anitteilinitsinni. Pimmariuyumi iqqanaayaahangikkuvi taima anitteiligaahartuti angeqqassinni. Tamakkua tilisijjuttiu yatulilaartu naggajaumi May 3.
Through contact tracing, a positive case of COVID-19 has been identified in a staff member at Iqaluit's boarding home. All residents who were at the boarding home during the exposure period are being notified and tested for the virus. All in-territory medical travel flights departing from the Iqaluit boarding home were cancelled yesterday to allow us to trace and test high-risk contacts. On Tuesday, an individual was transferred to Baffin Correctional Centre. As per correction protocols, this individual was isolated from the general population and tested. That test came back positive. Additionally, 3 more unrelated cases of COVID-19 were identified in inmates. All positive cases are isolating at Baffin Correctional Centre. The correctional facility took immediate action to have all residents swabbed for COVID-19 and separated into a cohorting system to ensure physical distancing is maintained and to limit transmission.
Katiyaminiuyuni qaisaqpalliatillutanaluna toyoqaloq Nunavut 19 limmi iqqanaajartingani iqalunni tammaaterbimmi. Teikkuat tuyurmiyulima tammaaterbimmi ilautun taina Nunavut toqartillugu qauyakkartaussimalertuqauyisartaussimallutillu Nunavut taarsimangikkaluamangata. Nunavulimaami annaambiliartut tikiqattapalliayu aullaqattapalliayun iqalunni ippatsanoqqartitaukeinnalaortu tamannaq katiyauyuminerni qauyisarpalliatilluta piluanguartumi uluqianartumiinnersani katiyautuinnarialiminerni. Naggajaauleqqimi tiguyaussimayumi nuttertauyoqalaunga qikertaalummi ikayortauvinganu. Taakku ikayortauvikkuatuaginga malittugi taanna anitteilititautsautigilaortu qammalu inuqassannu teilititaukeinnartuni ammalu qauyisartaulertuni. Qauyisartaurutinganalunaiqtaulooq Nunavut toqarningani. Ammalu ippatsarpingasukkanerni tuqaangangittuni Nunavut 19 liminalunaertauyoqalaummiyu teikani tiguyaussimayuni. Taakku analunaertaussimayuluma Nunavut tuli anitteilititauyu qikertaalummi ikayortauvingani. Ikayortauvimmi qaniiligiat sautigilautu tamakkua iluunnati qauyisartauqullugi Nunavut 19 qangikkaluamangata. Immikkuilertitaulluti maqquulingatillugi taimaa inuuqattigi qanigiluattailequllugit ammalu searmartailititsiqullugi.
Also yesterday, a resident of Iqaluit was medevac to a southern hospital after developing complications due to COVID-19 infection. This individual has been hospitalized and is in stable condition. Out of respect for the individual and family, we will not be releasing additional information at this time. The past few days have demonstrated how quickly the situation can change. Our public health teams are working around the clock to track and contain the virus. It is extremely important that everyone follows the public health measures. Wear a mask, do not gather, do not visit other homes, and if you are sick, stay home. If you have symptoms or are a contact of someone who is COVID positive, please call the hotline. These measures will help contain the virus and keep everyone safe.
Ippatsartauq iqalummiumik tuavernartuku hangatuyukku qallunaanu aullaqtitauyoqaloortu taanna qanimmaguti qalualerninganu Nunavut 19 nganu. Tana unit si mayan na belumi amalo kanui gunni palleluni. Tana hausi kaya ko nagokinaw ni ano ilang ilo tako asik kaningin no hausi kajangit ti kutat sumamitsan. Ulugalaw si mayo nalo na ko taw si mayo kanuti kita man nakilame alo asit sa kundang ningani. Ana hamnang itulirin mo kanaya ti butay mai kakalima sikhengo ya malit ti kanaya inak tu itay ko hayo sakpalalo ti katiyaw yung minang nasak maktay litit sik nagmulo. Pimario na pangulik ko tako kikuli mamaligyahan ning nitako ning anaham nang itulakin ng mamalik tao gyalin ning. Matuwas si mahatalo si katikatang ilusi pulakaya katang ilusi asingin no ang ikakayaw yun. Kani maguwilo ang ikasimatyo na hatalo din. Kani igutikapto yali gubit ubalo katiyakapto minigubin no badyo na 19 limbik ukalagun nakto ti ukalabiyo yun. Tamak ko malitaw yali kayong nakakon ng atasya maktaylitit sinang mo kikulimanilo at tanak tumitaylitit sinang mo.
Ken Driscoll, EPTN National News. Dr. Patterson, the positive case at the medical boarding home, how many approximately contacts did they have? How many people do you have to trace based on that positive?
Driscoll, EPTN kuniluta Patterson tana nalo na taw si mayo nabadyo anak tulit ang matabin ni katsini katiyakap tuminirba.
The original individual, I can't remember the exact name or exact number of contacts. We've tested all of the staff and most of the individuals who have been staying at the home and are waiting for results, and we're expanding our tracing out from that incident in that fashion right now.
Dahil nasibula pa minalo na tawlaw ti kamangitang katsilaw mga takatiya miningin. Kanayak ti lima at amalo teko katiyam teka ni tuminiw yu lima tamato bimikaw yisaktaw balya yu inawlak tuwi.
The reason for varying from usual contact tracing, our information right now indicates that the risk of exposure to individuals who are staying at the boarding home is low, but at the same time, the big concern is ensuring that there's minimal risk of introducing COVID-19 to other communities, which is why we took the step of delaying travel until we can get screening or surveillance swabs completed, and then do a more reliable risk assessment, and then consider allowing travel for at least some, if not all, of those residents, if it's appropriate.
Pedyo ta kalaw to tamak ba jigilaw ng mata tamak ko nga katiya minyo yun ito sa simayagum. Mana yolo kaya na tumilo ang inata yu tay kani katiya miningin ni tuyom ila tamata bimmi taman nalu asingin no sa makta ko naguno nalin no kingo ba kaya lawak tabo tamak ko na bila kaya li kawisak taw balya kanila ngin namalo ulo kaya na tumi kawisak kanila ngin ni tamak ko lalo na yung naaktabu tamak ko nga awla kaya eliminag no.
Dr. Patterson, you sort of started on it with your last answer. Can you take us through the timeline of what's going to happen with the folks who are at the boarding home now? When can they expect a test back? When will they be able to leave if they're negative? And what's expected of them when they return to their home community as far as isolation?
Lalo na iya kaya nalaw ita napigya ka sa katate hanok tay kanita tamata bimi hangak ko ng mga hangak ko kayo saktaw na mga ta hangalo kayo sa kuting uti kaya mga ta hangaw la ko nak sila mga ta no kadyo nak to hangik ko ti kisunite ko ani kayo gakaka.
We should have results. I believe some of the swabs are already complete. We should have the results on the rest of them today. And once we have those, then we can make the decisions on further travel. Our hope is that we'll be able to let them know by end of today, sometime later today or tomorrow at the latest.
Tamakwa ilangi kayo sa utiminyo yu tiri sa malakto piyari taw sa malakto ilangi ullo migiakan ni riyugiyabo. Takwa tukisi makan nilirap tigo tayo maala ko nang ningin ni lalo na sinayak tigo ulumi nungwan yung balokaw pa awla ko nak sila mga ta.
Jackie McKay, CBC News. How many residents at the boarding home have already returned to their communities, and people who were supposed to be coming here for medical, what happens to them now?
Jake ma KCBC kunni hatsi wa ulariq tumini inuna minno taikanga tamata bimit tumini. I forget the other part. Go ahead.
Okay. I don't have the exact number of people who've traveled since shortly after the outbreak was declared. The medical travel staff has been forwarding the names of medical travelers to regional staff who are able to track them and touch base, make sure they haven't developed symptoms. For people who are traveling into Iqaluit for medical travel, they're being diverted to other locations, other hotels or bed and breakfast or private dwellings to avoid the risk of exposure.
Tako hatsi mga takaw yung mga itakataman na pigalaw sa mamani sa mapalya ni kay kwa anya bila patuno tamakwa lahat taktulirijit ating inito ni sisimayo tako nung ikanayak tinu hawi yak taw hattatakho kanoy ko tahapalya ring ikalo mga ta tako le halon no anya bila reali te ko ngatab matak bimmo taw hattaron ne tutuyok me bimmo taw lutik ang kaya yun ito yung may titaw lutik or bed and breakfast.
How did COVID get into the correctional centers, and were there inmates from Iqaluit that have now moved to BCC that are the ones who've tested positive?
Kano no adyan ng 19 BCC may kayok taw bimu nang tay ko kay magigyak bimi nga law to tay ko may kayok taw bimu no taw yung miniuningin no.
We don't know yet how it got in. The three individuals who were in the general population two of them were found, this would have been Tuesday night. They were symptomatic, they were swabbed, and results came back early yesterday. As a result of that, the medical staff with corrections swabbed every inmate and all on duty, I believe all on duty staff as well, and found the one other individual. So they now have 4 individuals in isolation. Where exactly how COVID got into the correctional facility, we don't know. Further testing and tracing of off-duty staff and others who've left may give us some information on that. And as far as where they were when they were detected, the Minister of Justice is in a better position to answer that.
Hoy mga itong atako hano pingasu naluna taw ng mga takisani tema inokasakubin ni ken hattalaw tuin tako makko naggadyaw ulit kiniunungan ni naluna taw law tu hano iguta hapalle alang ng atik ipatsalo naluna taw sut inobadyan ak tahang ningin ni Ana silti te kani kikulimani hawi sakat sani not sige aktulilaw tu tigo yaw simayulimani kamalo kanayak tilimani tako nang sitama ilang taw hawi yaw law tani tele khataw lak to sitama ulak to katilugit nakiro balokano ikayok taw bimu ng mga dalo nang tako ali kanaya law itu kanayak ti hawi saktaw balayo inaw na to to kisikan ni runang na arte gutana minister nga maligalari ko future manaksa.
Thanks, Uli. Thanks for the question, Jackie. I guess in a nutshell, as Dr. Patterson mentioned, the 3 cases that were identified at the Iqaluit Center were identified through symptoms. So they came forward with symptoms. As far as the source of it, that's still undetermined. We have to take into consideration that visitation was quite restricted before the outbreak occurred and has been locked down now. The measures that staff are going through right now on containing it are exemplary. I've gone over the contingency plans, and we've had a year to prepare for this. So the 4 people that have tested positive are isolated in the BCC unit that has not been repopulated since the fire. So that's given us some extra space at the moment.
Kaya na may tako na inakalagulo ta Patterson kiyo kataktakalo nga Takwa pingasunalo na tao si mayu makikiabi mi tumini tay makano ko ta hapalalang ng ngata nakinga mga kaya manang ito galwa kasi nili pula kaya biulo akata kunix law nga taman na sayang makpalalak tilugo ikanaya tilo pilirit siya si mayu marimata siyang maktailit itsinir mo taman na nalo na tao law tinagulo ni akaguli mami walang ayak si magunalang ngata tako si tamani tailit ito yu Ikayok tao me ta na ino laos mangito ikwala laos mamani tay na inigiyaw kanil kay nalakigon nakto.
We just get a clarification within that question. You keep referring to 3 inmates that tested positive, but then also this 4th other case. So what's the difference between these 3 people you keep referring to and this other one? Is that a staff member?
Tukisanakti ako ta ko pingaso na kataw takalo ataw sikan na kataw takalo tay na kanayak tiyo vai lang.
Thank you, and sorry for not clarifying that for you, Jackie. But the original first case was an intake inmate. So through the screening process, during the intake process, it was identified as a concern, and they were tested, and then that test came back positive. And then subsequently, the next day, some symptoms were reported with 2 inmates at the Makagarvik Center, and subsequently through that testing rollout that. We tested all on-site staff as well as all inmates that were in the facility and then identified 1 further case. So there's 4 in total, and those all 4 are isolated in a unit within the BCC facility.
Tana sigula pa tiguyaw litay naktilugo hay saktaw yumini hay saktaw katang atanalo na to yumini nubadyo anak to hamningani Kau parok tilugo tay ko asing ikano ko ta hapalalang ng ati makigyabi mito kau isakta lakilam na ngate kanayak tiliman ano tiguyaw si mayu limalo tay may masita mabukati lima tiguit tay kani aniteli titaw yu BCC mi.
Emma Tran to the Canadian Press. What is your department's policy for isolating individuals at BCC? We know that there's extra space there right now, but if there's more cases, what will you do?
Emma Tran to Canadian Press kun ni pili revisi kano ilod na ka singin ni aniteli video na to niya to naktakakayak ka pitakat kan nitalang na ka.
Thanks for the question, Emma. And I think it's very important to acknowledge that, again, we've had over a year to plan for these scenarios. We do have anticipated if there's a large outbreak in our facilities that we do have off-site measures that can be utilized. Again, just for security purposes, and that I don't want to go into details on that, but we do have off-site strategies.
Off-site?
Off-site.
Kaya namin tako akaguli mami la palungaya ko naksisimalagat ni riw lawat daw sa maktukalong nakatako asingin ni indigiyaw ko nakto ni nalong na sistema yung hakto kasi ni iluling yung kausari ko nang itang taman na ulukan nakto may kutaw tuwin nakakam ningin no tapan yung ito kasi asingin ni init sa hakti taw ko nakayakto.
Maybe a question for Dr. Patterson, but what's the vaccine uptake for inmates at both correctional facilities?
Katsiwa kapayaw si mayo tay kani ikayok tawin nito eh.
Thank you. Thanks again for the question, Emma. The vaccine has been offered to all staff or all inmates and staff. We can't force anyone to take the vaccine, obviously. With regards to uptake, again, I don't want to get into too much level of detail just for the lack of or for the security. When we're looking at the Makagarvik Center and the BCC, we're talking 46 individuals, so the privacy would be pretty skewed if I started giving stats on that.
Tako at ito titaw katak si mayo kapayaw kataw ko nakto ti kanayap ti lima ti ko yaw si mayo limalo ang si mangito ni loayaw si gun nakata kasi ni kausari gun nangitak ka tay kani makikiyapin mi ikayok taw mi 46 ng mata kikunin ni kawi naksito nakakanga kausakan ni Chang.
Justin Batar, Nunavut News. My question's for Dr. Patterson. The 2 cases that were reported yesterday in Kingai, it's been about a week since the last 2 cases were reported. How are those detected?
Justin Batar Nunavut kun ni tay ko amako kingang ninalo na tawlo to pinasa ako silmangon simalangat. Tako alam ako kanyo yu kano kawi yaw laka.
Those two individuals were diagnosed through routine testing of people who'd been identified as contacts.
Tay ko makukan ni nalo na tawlo tu no wadyo anak tuli how is saktaw katang at amalo nalo na taw si maluti kati yakak tu minuningin.
And just to be clear, they were contacts of the two people who were first diagnosed in Kingay.
Tako kati yakak tu mini makukan ni tay ko ni nga sibudliw law tu ni makuni.
There's been 21 new cases of COVID in Iqaluit the last 2 days. Where are the majority of those coming from? Is there one source, or are they just kind of spread out?
21 ngulang atata ko nuwadyo anak ta si mayo ikalon ni nakingalo ang ngak si mayo ba nakingalo ang ngak si maba.
They're spread out, and right now we have a number of incidents of community transmission where we don't yet know the exact link. We're working on tracking those links down as best we can, but yeah, there's no one source at the moment.
Tako nakituin na si mayo tamak ko sa magbeyo hatak si mayo. Nunalin ni sa magpala ni ko nalo na taw si mayo namo nakinga ng mga ata sa magbeyo ni miningin nalo na taw si mga mata suli kawi gaso akatigo. Kasi ani nakinga to mini mga ata suli nalo nakto.
Trevor Wright, Nunavut News. There are a number of southern construction workers working on the new healing center / jail. Are they also being tested?
Trevor Wright, Nunavut News kun ni tay ko halo na ni nga sa mayo tay kani ikayok taw bi may takaw sa may sanayo kawi saktaw na akiba.
I'm not aware of any of them having been identified as having been exposed. If one or more of them had been, then they'd be under isolation and getting tested at the appropriate time.
Kawi mang ito ta ko nalo na taw sa mga takatiya hak to mini mga ta ilangan ni kawi yaw yo kan kanit teliga hakayak to kawi saktaw lutil.
Have you guys gotten any more results from genome sequencing from down south?
Tako halo na ulat itaw law to no kawi mabisi nalang mga nabatyan no.
No, nothing since last week.
Aga pinasa ko siya yung miniaga.
Ken Driscoll, EPTN National News. Dr. Patterson, right now, health department staff are dealing with testing at the boarding home, testing at the jail, and contact tracing all over and testing for contacts. How long can the health department staff keep up at this pace, and is there any opportunity to bring in relief staff for things like contact tracing?
Ken Driscoll, EPTN kunni. Takuan na hamang ituloy ko kanayak tingin piyat sa haptung mari ulang matakaw sa hatak sutik tay kani ikayok taw bimmi malo tamato bimmi anulat si bimmilo katiya haptung mini ulutilo hawi saktutik katiya haptung mini unik kanu tigi ang matigum nam na katamak ko kanayak tingin malo kingobek taw yutsani atoy na ham na kanayak tini kingobek titsani.
So to be clear, all of the testing done at correctional facilities has been done by nurses who work for the Department of Justice.
Tukisanak tigial gutay ko hawi saktaw hatak to ikayok taw binni tay kunungan na sorting ita nam miningin no maligaleriyik ko.
The operations divisions is exploring every opportunity to bring more staff in as they find them. And they're diverting some of the workload to other staff who can't be seeing patients right now, so physiotherapists and others, and also getting staff from other regions to support the virtual work, the phone calls and other work like that is also vital for our current response.
Ako ulat sinamo kama yo hay sakto kisulimani tamak ko kanayak ti pilluwid kanayak ta ti sasungin nakto amalo na ni sigay kami kanayak ti satak to ilang illo piyat sa halwang ituni tema tilisakatta tasingin iqanayartinik suulu tamakko iqailisartuliriyi takagunnangin mata ikayok taugelinni iqanayarting illo assingin avittorsimaviuyuni uqaalaqattitauqattartu tamakko pimmariummata iluunnatti tamatumunga.
Right now, we also need the cooperation of all residents to decrease the number of contacts that they have. The first few days after we declared the outbreak, the average number of contacts per case was 10 or 12. It decreased a little bit and has started to creep back up over the last few days for a variety of reasons. But we know that the more social contact people have, the further and farther and faster this virus is going to spread.
Mana yo ikayok tigi tuina ulaga hassimayo Nunavummiu tamakko katiya hattartangin katislo teile hattahullugi tamanna naluna taqatartillugu saamma palleane tako apersortu tigo hulini 12 no tako katiya miningin namissulo hattalaungata tako hatsinna qallersimayo hattalautuugalo katiya miningi kiseen amissugo palleagalaalo mimmata ullugalausmayo ni tamanna pidjuti marialo makatisitte hattarne tema khilamiunassakku tamanna noqartigunnaqattigu saarma palleane katisilo asinginni katisilo hattangip kainnaqata.
Premier Savikataaq, please. Premier Savikataaq, I don't want to overcharacterize your comments at the beginning, but you were frustrated at the level of mask wearing that you've been seeing here in Iqaluit. I was wondering, could you get more specific about that? I'm wondering exactly what are you seeing out there in Iqaluit that brings up that level of concern?
Simulati kami Savikataaq tana matuarne matuarsamaqattarne muiqalunni atuqattangituni takoqattartumini uqauga binalunayaraaru tamaani summaisumaalugittaqiu.
Thank you. It's just that we know that mask wearing will stop the spread and stop someone from the likelihood of getting COVID-19. And it's one of the things that we can do that doesn't really harm anyone. It hurts not to visit. It hurts not to socialize. But to wear a mask, that's one of the easiest things we can do. It doesn't hurt you. It doesn't hurt others. And it's one of the easier things that we can do to help stop the spread of COVID. Dana kina pakhimana matwa khimana ayong nangin na pangu manta kuninga anya tailitichi kunita pekoyo tuni ublalegwa hoktugut ublalugta wa hoktugut dana kiping unak to ya inokatigi ni katik tangikluta kihanitana matwa khimana kina pakhimana anya nangito uwap tinun mata ko inuk kanang aanang nangito tan ayo nangin na pangoyo atolugo tan nuban na 19 anging langimat nunubuy luani da nunliptin ni.
Jackie McKay, CBC News. My question is for Dr. Patterson. Can you say how many people are currently at the boarding home, and do you have a breakdown for residents versus staff?
Jackie McKay, CBC kunni khatsiulau qataykani tammater bilmilautu iqanayartiit ammalo annabilarsmayu.
I believe there's about 60 residents. I don't know how many staff work there.
60 galautu tuyumiyumini annabilarsmayu hawayamangito khatsiu mangata qinayartingi.
Currently, there's no daycares open in Iqaluit. I understand the GN has been talking with them to try to get one open. Can you say if there's any daycares currently open?
Pairibinni matuinga yohangimma Iqalunni tusarsimamma Nunavut makkunginni matuiq sigasuanga tataussummi matuinga yohaqqa pairibinni.
No, there's none that open, and it creates stress for creates difficulty for essential workers because it aggravates childcare problems.
Maana matuinga yohangit tutaman tahana ko to yut sa uyugalo at ikununga kanaya na kailin no pairivihaktin nago.
I'm a transfer the Canadian Press. So would you say there is community transmission in Iqaluit at this point?
I'm a transfer Canadian Press kun ninunalin ni sa makpalya ni na kailin kunnalikhi tamani kalun.
Yes, there is.
Minister Hicks, please. What is your capacity to isolate inmates at Baffin Correctional Center, and at what point would it have to get to for you to send people outside?
Hanutigene hakka aniteli viugun namninga ikayoktaw vimmi amakangakku aulaktit sa kattaqya khalirayak.
Thanks for the question, Emma. Basically, right now we have a fairly extensive level of capacity with the BCC. The inmates that were there prior to the fire, a lot of them are out of territory right now. So it has hindered our repatriation of those inmates right now because we're utilizing some of the empty space in there, and we're hesitant on bringing those inmates back during an outbreak right now where we may have to utilize that additional space that is available. So I don't have capacity concerns at this point. And again, like I'd mentioned earlier in an earlier question, we do have contingency plans to use off-site space as well.
Mana yu ini hatsiak tu taikani ikayoktaw vimmi taikwa ikawalat halau tillugu tigayaw simayaw laktitaw yung mata Nunavut sila taano mana utuk titaw taili kay nangata sa makpadlayo hangingani mana yu ini tsahangi kayak nang mo sumalum nakto hangit yung tayo mapam na simalaw nga taas tingin ni nayoktaw kay nakataw na kayak to ni.
Justin Patterson, that's Act News. The individual that was medevac south, were they admitted to a hospital here beforehand? Have we seen any other hospitalizations? And what's the overall kind of asymptomatic breakdown of the cases so far?
Justin Patterson at sa kun ni tayo na tuwag nakto ko hang tayo ko lakti tayo lang to halo na ano tayo maasik kaning ini tayo ma ilang ilike hanoi pa balo ilang hanoi ko hang nila.
They were assessed at QGH here in Iqaluit, as almost everybody who goes to Ottawa is. I don't know what the current percentage for symptomatic versus asymptomatic is, but as of Monday it was 75% of individuals were symptomatic.
Were? Taman na hawis ila kikat tani anya bila katang ata hanoi ko halito ay kami pilwate mi arawa mo taw na tilugi. Ay mangito 30% ingit kisa ni takwa 75% ngiman na yo nubat jo nakta sumayo hanoi ko halik sumayo.
Just to clarify, have there been any other hospitalizations?
Asingin ni unit to kalakha.
No, there's only been the one.
Tan na to atawsi.
My next question is actually for the Premier. I understand that last night or yesterday you spoke with Justin Trudeau, and I was just wondering if you could summarize what that conversation looked like.
To sap to mini kakatigil ang kabilang yung Justin Trudeau kano house kalakisi.
We have asked for more funding, for more COVID relief funding, and he assured us that we are getting more COVID funding to help us out with our current outbreak. Daan na Prime Minister kakatigilaw ko ipakak na tukira kima takina yung mitan nuwan na jo akalang migap ta Nunavut iloni. Daan na Prime Minister kakatigilaw kita na kina yung kaina kina ta na tu ta na Iqaluit na tu suni nuwan na jo man.
Trevor Wright, Nunavut News. Some Nunavumian outside of Iqaluit don't seem to be getting the impression that there's a lockdown here in Iqaluit, despite there being one since the 15th. What would you like to say to those people, I guess?
Travel Nunavut News Kumni Nunavut me Hali Silatani to Matu Manitini Sulayo Saktu Yang in Matate Mangan 15 minute Matu Simagalo Artilu Tate Kwakano Tigayaki.
Just in that, I believe it was the last press conference, I did state exactly what the lockdown is here in Iqaluit and when it started. As starting on April 14th, that the schools were closed, the bars were closed, restaurants were closed, non-essential businesses were closed. There's travel restrictions to Iqaluit or from Iqaluit. So for the communities outside of Iqaluit, there is a lockdown in the community here. And I can assure them that we're taking the safety of all Nunavut mute into consideration, and that's why there's been a lockdown here in Iqaluit to limit the spread of COVID-19 in Iqaluit and to limit the spread of it to we don't want it to go to other communities. Matna tana kingun lami TV ko to kana khima ko la tunga takwa Iqalung ni April 14 pigal wa takwa email view kwa khimayut ni gayak to view kwa khimayut ilin na view kwa khimayut takwa nang minakaktu ta ukuenge ga kangitu like nakata wi alung itu kwa khimayut takwa ting mi ho ka wi ala ting mi ho kut ila ting mi ho ko ina no wi lo na la ta ta takwa kiname akalung nung yo umbalo ba kiname akalung ni aul lawaktu ayung goti miki alileo miki hani piluti ayung ina mata takwa nunali hilatani akalu hilatani to qawima qoya katana Nunavut menera chatigo tana akalu ukwa khimayut amatana ihuma qolta akalung nu umbalo akalung ni aul lawta ayul khimayut takwa Nunavut menera chawatigo amatana akalu iluani tana nuwan na angig dilwa kong gaptigo.
Next question is for Dr. Patterson. You mentioned that this vaccine's successful against this specific variant, but what determines a vaccine's, success against, certain variants out there?
Sumagawitan na kaputi atuti hamra sigutat sumungasid jipala yung manalo na tao simayumo kano kayo magabi.
So as variants are identified, researchers around the world are following cases of individuals with infection with the new variant and comparing the rates between people who've been vaccinated and people who've not been vaccinated. And the evidence from since B117 was first identified shows that it got the same effectiveness from the Moderna vaccine as the Moderna vaccine is as effective against this variant as it is against the original strain.
Kamakuasid jipala yung nubadjana inalo na tao pala hatitidluwi kawi sakpala si mamata tamak kuning nubadjana tao si mayuninuta nilo hatsi uningin ni tamakwa kapiyaw si mayu ambalo kapiyaw si mangito kawi yaw si mayu na B117 tamani ilakto na civil fami nalo na tao tidlugo tatsi mga mador na mo sa pumiyaw guti gundat siya ninganik tatsi mga civil level optimini nubadjana kami.
Ken Driscoll, APTN National News. Dr. Patterson, the Iqaluit boarding home is one of the facilities that has basically connections to every community on Baffin Island. I'm already getting notes from people in some of those communities. What should be the level of concern for people returning to communities from the boarding home in Iqaluit, and what steps should they take once they get there?
Ken Driscoll, APTN kunni hawi magatatan Iqaluit Tamaterbe Nunalilimano Tokang Makikatalo me Hanotigi Somalo Tahara Hakate Haluning Artomini Nunamino Paleanacto.
So first of all, the boarding home had some procedures and policies that kicked in as soon as the outbreak was declared to limit the exposure between staff and residents and the exposure between residents who are from different rooms or different traveling parties to minimize the risk of spreading it to other communities. Right now, tracking the individuals who have left the boarding home and have returned to other communities, and so far tests on all of those individuals have been negative. I'll let Uli interpret that because this is going to be long.
Already long.
Sorry.
Civil pamitan na na tawlo to take ani tamata bimme take ani atwa ga haliri la ngata sama palla yo palla chauti gertillugo surlo katitele hatta suti khana yartingi taikoalo to yommiyut amalo awlassima hatigi mikkunga titawga so hatta suti taima tamanna singin nuna no sak makpalla ya khunago taiko awlassima gertu hawi kattaw simalertu ullumi mo taiko ilunnate na novajuana to hangittu ilunnate.
For the individuals who are there right now, the information available to us at this point is that it's low risk, that they've been exposed to COVID-19 by any interactions with the staff members that are positive. But out of an abundance of caution, we took the steps to delay travel out for those who are there right now until we can get them swabbed and get that extra reassurance that it's safe to travel.
Taiko maana taikani tuyomiyu tukisisima yakku taiko ulugana tumingin narsai katiya hattumini tuinnaga hamnini nuvajjana 19 limmi ammalu qana yattini katiya khalwateli titaw hattartu sani ujassu siakanne mallu ulugana tumi tayli titsine mo taiko awlare kingo bare kayna lawattigo taiko khawi sakta gutitsani sollungi no atsibi ulawngin ni ammalu ulugana tumi
I expect that I'll have access to the remainder of the results later today, if not already, and then we'll be able to do a more detailed and in-depth risk assessment and arrange travel if possible.
Dr. Patterson, we touched on this on Wednesday about the relative age of the people who have contracted COVID-19. On Wednesday, it was fewer than 5 people were 18 or under. I'm wondering, is that still the case? And what more can you tell us about the age groups of the people involved? I know you don't want to be too specific for privacy, but if you could give us some age ranges.
Dr. Patterson, pingat sumyo kayo gabita ko hatsin kayo kayo hatam mga tano badyan akta sumayo. Hatsin na ni kalo kayo gabigay tin kayo lito ngani lo palimay to ngani. Sulitay may pa hatsin kayo kayo hatak taman na ko sa iya lo kaya hangita kalo kang muna tuloy pedyo tigilo kasi ni kano kayo gumnakay.
So one clarification before I get into that answer is that the other thing is that everybody who's left, other than essential workers who've left Iqaluit after April 7th, 10th, are expected to isolate for 14 days on arrival at their final destination. And that would include people who've left the boarding home in the last few days, and that will apply to anyone who leaves Iqaluit for medical travel today or any of the days moving forward.
Tukusenak city siya kay nalitat ko halunninga tulima mini April 7 balo 10 tungani taiko ani teliga hatangata taiko matikibingin no nalingin no luni 14 ilagi yaw luti taiko to yomi biminga temini tamata bimme awla hatta simayu tayma sulani teliga hatta tukikulima halunninga temini.
With respect to the other question, the number of individuals under 18 is still too few to report. And the majority, more than half of the cases, at least the last time I looked at the numbers, majority of individuals are between 20 and 40 years of age.
I pa apek kutigira tafte hatchioning in 18 new kiuli tungani. How you get along like king look pan mitako. I mean soon as say okay hatak to 20 and malo 40 akumningani.
Jackie McKay, CBC News. My question is for Minister Hicks. The essential workers wage subsidy ended on March 31st. Are you going to continue that, or are you going to reinstate that subsidy?
Jackie McKay, CBC Community ko kanaya halakituno kina sangin no ilagay ako tiyo isulilaw nga March 31 ta na kayo sikan nila ka.
Thanks for the question, Jackie, and I do appreciate it. I think it's very important to acknowledge the essential workers that have been going to work throughout the territory, throughout this pandemic and through the outbreak. This outbreak has kind of changed our gears a little bit. We were looking at letting it expire. We're going to have to reevaluate as things progress. I do want to thank, again, the federal government that started out with giving the money and the flexibility for it, but we will be continuing to look at that and see how, as the Premier announced, the third phase of the small business funding is definitely a step in the right direction to help affected businesses across the territory. But I don't have a direct answer for you today. Thank you.
Quick last follow-up.
Hold on. Tako pimario go kay ilisariyaw ga hamni tamako pimario yun kanaya katakto Nunavut kuya git sa tak taman na sa mapalala tiluwas taman na si jiro taw si mamman ta na isulilaw ngay kayo tiulaw to kisay na kawi sakkan na hamna tabu kuya na may tugi gawang to hakko kina ya hatit sila ngata taman na kayo sitin na mga tigo kawi sakna tabu kisay ni sibulak to hakama Mikiyuti no namin nakalani kayuti takkan nila may mata na kasi ay pa kiyukun nang itaka.
Sorry. Just, I know we're trying to wrap up. For this outbreak, have we had to dip into the government's contingency funding?
Taman na sa mapalala tilugo government ko daliw ko mainikinaw yan ato kaya hasimabi.
Sorry, I don't understand the question. Maybe I misheard it.
The contingency funding in the budget, that was, my understanding was that was money specifically in case we need it for COVID. Have we had to dip into that funding due to this outbreak?
I already said that. Go ahead.
There's so many different pieces of the pie that are floating around right now with the hubs, with the airline support, with the small business grants and things like that. I'd have to check the current balance of that account, if I can use that term. I believe we're very close to expending all of it, but I just don't have those numbers handy, Jackie. If you want to follow up with me, I can get that information for you.
Mana yami so matakina yang no to gali to kaluna ni to yung mevino hangata yu lagi kunun mikiyuti no namin hati yu no tay ko kina ye hanu tige yami ato kalang mga takaw yisa kaw yigari alinga atok taw sa malang mga ta na siya ko kiwiyakan ni kumnakto.